A warning tonight that hospitals are reaching a tipping point as Ontario records more than 2,000 COVID cases for the second day in a row. They're being told to clear beds for a surge of patients.
I anticipate that the situation will worsen, and we only have so much capacity.
The fear has always been that hospitals would be overwhelmed by COVID patients, the way they were in Italy and New York during the first wave. Today, the Ontario Hospital Association held an emergency meeting to discuss an imminent risk of overwhelming conditions. And in this memo sent yesterday, Ontario Health warned hospitals across the province to prepare to activate emergency plans immediately. And for those in red and lockdown zones to clear up to 15% of their beds to prepare for a surge in COVID patients. Doctors have been warning the situation is worsening.
The hospitals are ballooning with patients, and I anticipate that the situation will worsen because we're seeing a steady number of patients with COVID and also with non-COVID related illness.
The provincial government today reported 932 COVID patients are in hospital. 265 of them are in intensive care. At the height of the first wave in the spring, the numbers were slightly higher. However, hospitals were only at 63% capacity because tens of thousands of surgeries had been postponed. Today, hospitals across the province are at 88% capacity. 3,000 frontline healthcare workers will get their first vaccinations in Toronto and Ottawa this week, but it will do little to ease the burden on the healthcare system. Hope is close, but not close enough.
What I'm concerned about is that as we go forward with this pandemic and the case numbers and hospitalizations and ICU admissions continue to rise, that we'll see reduction in services for things that are more urgent. And that's really something that we need to avoid.
Now, just minutes ago, I spoke with Dr. Chris Simpson. He's with Ontario Health. That's the organization that warned hospitals to prepare for a surge of patients. He tells me they're trying to be smarter than the first wave this time round, and instead of canceling all non-essential surgeries, they're going to use a dimmer switch so non-COVID patients still get care.
We need to figure out how to ride these waves. The pandemic isn't going to be nice to us. It's not going to do us any favors, but we can be smart and strategic. So we can create capacity by improving throughput. So patients who are currently in hospital who are destined to go to rehab facilities or complex continuing care, we can accelerate that movement. We can literally create extra space.
You can't magically create more staff. You still have the same number of doctors and nurses who can care for these patients. So how much more can they sustain? I mean, they must be exhausted 10 months in.
Well, you've hit the nail on the head. It is easy to repurpose space and roll beds in and put up tents in parking lots. And I mean, we can do all this, but most people and places are learning that the rate limiting step is indeed the health human resources. It's the staffed beds that we need. And certainly the healthcare workforce have been, outstanding.
Are you worried? Are you worried about what could potentially come?
I think, the answer to that has to be yes, but I'm also confident because I've seen the level of planning that's gone into this.
Now, Dr. Simpson says if you have an emergency, you should still go to the hospital. If you need a procedure, you're likely going to have to wait a little longer.